For section 1.8, other unique forms, most of these forms I have either created in Cornerstone, the computerized, the digital chart system we have, or have partially either scanned in from other forms and incorporated into the forms we have in Cornerstone. This is a client communication. Anytime a client calls or we call a client, there's a checkbox here, call from client or call to client, and the initials of the person who's either taking the call or making the call. There's a message here for what we're telling the client or the client is telling us, and then either our response back or their response to us if they do call us back is listed here. Another form, this is a client communication, but is specifically for private cremations that have been returned to the hospital. We have here called client, talked to owner, called client, left a message with a family member, called client, left a message on their answer machine, or called client and unable to leave a message. And if they call back, usually they call back stating that they will pick up the remains of their pet at a certain time. We put that here, so, and then that way if anyone else attempts to make a call, they can see in the computer that someone has already done so. This is a medical release form we have typed up. It has our information at the top, and then the computer would automatically fill out the chart number, the client's name, the date, their phone number, and specifically the specific patient here, information, and then a spot for them. We print this off, and there's a spot for them to sign, and this goes into the regular paper chart. This form, we fill this form out, and we have the information from New York State on why a medical release form is necessary. A lot of clients have a hard time understanding why they can't just pick up a form or just have us fax or mail their paperwork without some sort of authorization, and this does inform them of why we do that. This form is basically a referral form to a different hospital. Usually for Nassau, does a lot of extreme dental procedures, but this form I've scanned in and have put it in so that a lot of information, like the doctor requesting the referral, the date it's done, all our hospital information is in there, and then the client's information and the patient's information propagate in there when this form is pulled up. It saves the doctors a lot of time from filling out information before they fax this form over. There's a lot of time just saved in not having to fill out all this, and the only thing the doctor has to do is either type in something here or cut and paste from their exams into this form. Same thing with this. This is a form to Shaker Hospital, and information would self-propagate into this for the referring doctor and hospital, the patient's information. This is a referral for upstate that I've made. Everything is put in here for the patients, the clients, all the client's information, the patient's information, our information, the doctor requesting it, and all they would have to do again is just cut and paste from their exams in the computer, or type in some information they want to add into these two areas, and then we can print that off and fax it to upstate. These forms really save a lot of time when we're doing referrals out. This is for an in-house procedure, in-house urinalysis, when we're using the Siemens multi-sticks, the reagent strips, and when a technician or an assistant pulls this up, they can just hit the appropriate checkbox for the glucose, bilirubin, ketone, etc. And then we usually do specific gravities by refractometer, and that we can just type that in down here. We have all three hospitals have their own laser therapy equipment, and this is just basically I've made from the menu system from the laser machine, so that we can differentiate feline, canine, their body weights, the body types, coat length, skin color, coat color, what kind of therapy is being done. You have acupuncture, arthritis, edema, granuloma, wound, pain, trauma, post-surgical, anything additional from pyotraumatic dermatitis down to just otitis. Or if you're just treating, you can select the area to be treated, like from a 1x2, 2x2, all the way up to a 3x5 area that the machine has settings for, and you can put down here, type in areas to be treated, the power level that in watts that the laser will be operating at, and the time that the duration that the laser was running at that for that treated area. So all that's typed in so that we can just pull that up whenever we need to. When we have x-rays reviewed by an outside person, this form, we have it's a small form, but we can cut and paste the findings from the doctor who does the review and just put them in here so that they're in the record. Any notes that the doctor types up for the patient, the computer would fill out here that it's like for Fluffy and then the last name O'Donnell, for example, and then the doctor can type in whatever that they want the patient, the client to know, information for the patient, and then the computer propagates the doctor's name and title here. This last one is if patient comes with records, instead of if it's emailed, we can cut and paste and scan them into here, and not have the bulk of the physical chart. Or if they do have physical copies, we can then scan them into our computer system and place them into the digital record. And this is just a blank form. Everything from here, anything that they brought would appear below this line, and we can type in what kind of documents were brought with the client.